Hey everybody, I am Diana Braun from the Knee Zone. I'm joined with my husband and expert surgeon, Dr. Raj Sinha. Judy had my right knee replaced 6 months ago, and I've done all the PT and exercise, but still have no feeling on the right side of my knee. Isn't that crazy? It's really numb, right? On the right side of my knee, and I feel like my flexibility has gone down in the last month. Your book has been wonderful. Oh, thanks, Judy. I'm going to say first and foremost, not unusual. So I was just talking to another client this week who was like, yeah, I don't feel like I'm bending as much. And I started asking her, I'm like, well, are you like doing your under desk foot pedaler or exercise bike? And she's like, no, I don't really want to do it. And she's like, yeah, I'm not walking as much. Like she really backed off of it. And I'm like, you got to keep, like the first year, you really need to be focused on it. The numbness on the side, the right side of your knee. I'm going to assume when you say it was your right knee that was replaced because it's the numbness on your right. That's normal. It will go away. A lot of people feel like really bad heat and numbness. It does go away. The heat is probably the most annoying early on, but that does go away, Judy. But I'm going to hazard a guess that maybe you've backed off a little bit on your exercise in the last few months, which happens to a lot of us in recovery. Keep moving. If you have access to a desk pedaler or anything like that, I think that you're going to see that. I am going to go over to Amanda on Instagram. Oh, you're my person. Sleeping at night. Still bad after 3 weeks. Let me just say only 3 weeks. Do you sleep on your side, Amanda? I'm going to guess. I'm going to take a guess. So let me know in the comments if you do sleep on your side. Sleeping was really hard for me too. I talk a lot about that in the book and in the recovery guides of like how to do this. And we did answer this earlier, Amanda. I'm guessing you may have joined us late. So I'm going to kind of regurgitate what we talked about earlier with sleeping. So some key things to help you sleep easier at night after knee replacement. Number one, make sure you're trying to do some of your PT exercises before you go to bed to loosen up that joint. Make sure you ice, especially at 3 weeks. Make sure you're icing and really elevating to get the swelling down. That's really going to help. And when I say elevating, that leg needs to be really straight up in the air, like toes even with your nose, and your leg needs to be straight. That's going to help. Now, if you're a side sleeper, Amanda, and I haven't seen that comment if you've said that yet or not, but I found like really like these Squashmallow kids pillows are really popular right now, but something really squishy. If you put that between your knees and maybe even another one between the mattress, that extra padding helped me because I'm a side sleeper. It was really hard for me. Time your medication as late as you can in the night. If it's something you've got to take with food, maybe consider pushing, a late night snack back as well to be able to take that medication, and always leave your medication on your nightstand so it's there and available. Because I had both my knees replaced at the same time, I would say, one of the most difficult things for me was sleeping in general. And I ended up eventually getting prescription sleeping pills because it was really so hard. So I hope that helps, Amanda. And I feel your pain for sure. Are red light therapy mats safe for replacement joint and scar? Yes, no problem. Might be now what could be challenging though is getting on and off the mat, because if it's on the floor, getting on and off the floor early in recovery is not very easy. So I would recommend you put it up on your bed to use the red light therapy, or if you're using like a handheld device. But again, you need to wait until after all the scabs have come off of the incision before you start using red light. And I was like cuckoo crazy about scar care. I mean, like, it was my full-time job. I was really interested in it because I have really long legs and I like to show them off. And I was really concerned about it. So once my, all the scabs had come off the wounds, I started using a combination of bio oil, some scar cream, and I used it like 3 or 4 times a day. And like, if any of you like meet me and I'm like, here, look at my scars, like you really got to lean in. They're hard to see. Now, I was also very careful. I kept my legs out of the sun for the first year. I had zero sun exposure on them. I wanted the scars to heal really nicely. And I talk a lot about this in the book too. And so if you're interested, red light therapy's become really popular. A lot of people are using it. And I think, again, as long as you're not having to like lay down on the floor and try and get back up until you're at a point in your recovery, I think that is a good thing. So hope that helps. Sandy, are massage guns safe to use on your operated leg? Yes, but we don't want to use it on the incision. But I had a massage gun, like I probably have it right behind me, actually. I still use it. So I would use it on my quads, my calves, my hamstrings, and you're going to realize, during your physical therapy times, like, because you're compensating, so you're going to use different like body muscles all the time. Pretty early into my recovery, I started going to assisted stretching. I go local here, shout out to Stretch Lab. Really helped me. I mean, they had massage guns there. I had my own massage gun. I would use that, but assisted stretching really helped me with my straightening and my bending. It was very gentle, similar to what a PT does. But again, your PT is really focused on your knee that's recovering. When you're recovering, we're using our bodies differently, like bilateral. I was using my arms to push things, push off of things a lot. And that really put strain on my muscles. And so I was early on, like getting assisted stretching. I was getting massages probably 4 months after my knee replacements, because I did both at the same time. So yeah, I'm a big fan of that. The massage guns are really, really helpful. And they have these new ones that have like these heated like heads on them. They're incredible. They're really incredible. Thank you. I hope this was helpful. We'll look forward to seeing you next week. And be kind to yourself and your knee. Knee replacement's hard. It's not easy, but it's worth it. I can promise you.